Hi, I'm Alisha from AdultSpeechTherapy.co, and in today's video I'm going to be talking about the yawn-sigh. So the yawn-sigh is for patients who have vocal hyperfunction or tension of the throat. So the yawn-sigh is used to relax the vocal cords. And how does it do that? So basically it dilates the pharynx and helps lower the larynx. So this is how you do the yawn-sigh. So you're gonna sit up straight and basically go to yawn. So open your mouth as wide as possible. And after you finish your yawn, you're going to do a sigh. Gentle when you do your sigh. And again. Typically, you will complete that 10 times. Easy onset is a voice strategy or treatment therapy approach. It's also a fluency strategy. So basically what it does is it helps produces vowels at the beginning of words. It helps decrease tension in the throat. So this is how you complete the easy onset. So first I breathe out just a little bit, almost like a quiet sigh. You can even produce a gentle H sound. And after I do that, I slowly turn on my voice by starting a vowel like this. Ha. He. Hi. He. Who. You'll probably notice that I've stretched the H sound and the vowel out, and that can help you create that nice, easy contact when you start your voice. This again is for patients who are having too much laryngeal tension, using too much of a glottal fry when they're starting their voice, and it can also be used in patients who demonstrate stuttering patterns. You may have some patients who present with hypernasality. We see this in patients sometimes who have dysarthria, voice disorders. What is hypernasality? So hypernasality is when patients produce non-nasal sounds as nasal sounds. So again, I talked about how that can be presented in voice and dysarthria disorders. So here's an example of it. So for instance, if someone says maybe baby, it may sound like me, maybe, like they're speaking through their nose. A great treatment approach for decreasing hypernasality is ultimately to help your patients become more aware of it. So here are some ways of how to help your patients with this difficulty. So first off, you can have your patient label. So if they listen to their voice, such as if you do a recording with your phone, iPad, or computer, have them listen to their voice and label it as that is nasal. Then as they start to speak and do different tasks, they can pick up on their nasality and label it, oh, I hear I'm being nasal right now, or hypernasal. So again, bringing that awareness to them, you may want to start with an audio recording. You can also then have them read several different words that have nasal versus non-nasal sounds in words and have them listen for the difference. You can use them as well, having a tactile feedback when they're producing these sounds. So again, if you're doing a tactile feedback, you're going to have them feel on the side of their nose, or 2 fingers is fine, and have them listen and feel for the vibration. For instance, if I'm saying nasal sounds such as M or N, ma, na, nice, no, new, I'm feeling the vibration right by my nose. If you have them do non-nasal words such as bow, boo, bee, bye, they should not be feeling any vibration going through their nose or near the sides of their nose with that tactile feedback. Another way you can have them decrease hypernasality is have them use an open mouth posture. So when they're saying their sounds, they will use an open mouth, having them exaggerate the sounds, and that will produce a more oral sounding voice or oral focus. The last thing you can do, which I have presented a video in our YouTube channel about, is the yawn-sigh. So the yawn-sigh technique, what it does is it targets lowering the back of the tongue and raising the velum or soft palate of your mouth or the back of the mouth. So this in turn focuses on more of an oral sounding voice. Again, bringing that oral focus, decreasing the nasal sounds. So what you can do is have them sit up straight. You're going to have them do a yawn, then sigh. And when you start to sigh, you will actually have them produce their sounds. So pa, ba, na, ma. Again, focusing on the production of the words in the oral cavity versus the nasal cavity. You again can have the patients use this yawn-sigh technique throughout their day when they're trying to speak. So when would we ask our patients to complete diaphragmatic breathing? This is for patients who have difficulties getting enough breath support to support their voice or speech. So we'll see this often with patients with dysarthria, voice disorders, sometimes even for apraxia of speech and trying to coordinate that breath support. So how do we complete diaphragmatic breathing? Often our patients will be seated, but sometimes they are in a bed, which is a great way to practice diaphragmatic breathing. For today, I'm going to be showing you it seated upright. So basically, I'm going to want to sit up as best I can, as straight as I can. And I tell patients to place one hand on their stomach, one hand on their chest, and feeling their stomach going out and in and focusing on that belly breathing. When you take a breath, focus on your stomach going out. Take a breath in through your nose. Stomach comes out and in. Again, breath in and out. Keeping my shoulders and chest area quiet. Again, I'm focusing on a big breath in through my stomach. Tell them belly breathing. So with diaphragmatic breathing, you can first have them focus on just getting the coordination down of breathing in your stomach, going in and out with your breath. But after that, if they've got the hang of it, you can then move on to sustained sounds, such as the S sound, like this. Try to have them hold the sound out as long as possible. Again, big breath in through the nose, feeling the stomach go out when the breath comes in, and if they got the hang of that with some voiceless sounds like S or sh or f, you can move on to some vowel sounds such as ah, like this. Ah. Remember, have them try to take that breath in, and when the breath is going out, they start their sounds. If they've got the hang of that, you can then progress on to words, phrase, and sentence levels. So that is diaphragmatic breathing. It is so important for our voice, motor speech patients, and in general, just talking. Vocal tension is when your patient is experiencing laryngeal tightness, They feel like their voice is strained. They may have vocal fatigue or a change in their overall vocal quality. And that may change throughout the day, as you'll often hear from them. Sometimes it can be due to behavioral related tension as well. So for instance, a patient with muscle tension dysphonia may present with a strained, weak, high-pitched voice. There's also patients who experience chronic acid reflux, and those patients may have changes in their vocal quality, such as hoarseness. A patient with vocal nodules may have a raspy, hoarse, or breathy voice that may fatigue easily throughout the day. You will also see vocal tension in patients who are chronic smokers. These patients may present with a low-pitched voice because of the vocal swelling, and they may present with a very hoarse voice as well, or even raspy. That's known as Reinke's edema. So today I'll be showing you some different ways to help your patients relieve vocal tension. I will emphasize that, treating vocal tension is a process. It takes some time for these patients to get better, and so just guide them through it, and consistency is so important. So the chant talk is one way that you can help these patients, in which you have them read or speak in a more monotone, slightly higher pitched voice like this. Hello, how are you? Nice to see you today. The next method is called the Yawn-sigh, which again, lowering the back of the tongue will raise the velum. So you're going to pretend to let out a yawn and then sigh. And then you can produce vowel sounds such as A, E, I, O. You can also try it with a wordless. Again, doing a big yawn, ma, ba, pa. Another strategy is called the confidential voice. And that is when it's like you're almost whispering, but not. Your vocal cords won't touch, such as, hi there, how are you? Like you're trying to be quiet with someone, but you're not whispering. So that's another strategy you can use. A video that I have on our YouTube channel also talks about relaxation and just head and neck stretches. So those are very helpful for patients experiencing vocal tension, such as neck stretches and even jaw opening stretches. Another strategy you can use is easy onset, or targeting voiced and voiceless, or open vowel sounds. For instance, easy onset is when you have that H sound prior, like ha, hi, he. You can also just do vowel sounds, A, E, I, or voiced versus voiceless, pie, P, by, B. And so those are some other strategies you can use with patients if they're having difficulties with vocal tension. The other last strategy I presented was the open vowels. And so that's in words such as bomb, mom. And those are going to also keep your vocal tract more open when you're producing those words. Good luck teaching your patients how to reduce their vocal tension. I can't emphasize enough that it is a process, and it just takes time with these patients, and just emphasize consistency. As long as they are buying into it, it will help them, along with some behavioral and vocal hygiene strategy. How to complete relaxation stretches, particularly for vocal tension. So these are exercises or range of motion exercises that you would give to your patient if they're demonstrating vocal tension. For instance, vocal hoarseness, weakness, or fatigue during the day, or especially in the evening. So these are great exercises for them to complete throughout the day, as well as initially in your sessions. So what I have them do, and they can do it in any order, is have them sit up nice and straight. And I would like to focus on first just head range of motion. So I tell them to just move their head around in a big circle, one way, and then the other way. And have them go several times one way and several times the other way. You can even emphasize them saying, sighing or an ah sound during this range of motion stretch. So I'm really focusing on just kind of relaxing and stretching out these muscles of the neck. If they have had a history of head and neck cancer or they're stiff, never to the point of pain. This is primarily a stretching exercise and we want them to relax with it. So another one you can have them do is just side to side with the head. So the ear pointing down towards the shoulder. Again, holding for a count of 5 to 10 seconds. Then the other way. And I typically go 5 to 10 times each side. Again, never to the point of pain. And then they can also go back and I'm feeling that stretch. And then down as far as possible. And relax again, 5 to 10 times each side, front and back with the neck. You can also have them do a nice jaw opening stretch and have them think about stretching open their throat. Wide and relaxing. Doing that again 5 to 10 times. You can also have them turn and tilting up. And you can really feel that stretch there. So again, you're turning, looking over your shoulder, then tilting your chin towards the ceiling. And you can complete that again 5 to 10 times. I really like the head rolling, and then I really like this one, feeling that stretch. You can really feel that, and if they feel like one is more helpful than another, go with that one. The jaw opening, if they're feeling tension all the way up into their jaw, that's a great one too. Some people even do like a range of motion. With the jaw. Again, if they're getting so much tension that it's up into their jaw. But again, this is for primarily the voice box area, so stretching in this area. How to complete voiced versus voiceless wordless. This is a voice exercise that we will teach your patients who have difficulties turning their voice on or making their vocal cords vibrate, or turning them off and having them not vibrate. So again, voicing is when the vocal folds come together and vibrate. You can have your patients practice by feeling their throat and doing these sounds in isolation, g, 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 versus turned off, k, 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 g, 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 k, k, k. Then I'll provide them with a minimal pair list. I'll have the voiced in the beginning and then the voiceless. Again, minimal pairs, one sound is changing the first consonant of the word. For instance, big, pig, gar, tar, zoo, sue, mat, pat. Have them focus on the feeling that they feel in their voice, feeling on their throat, feeling the voiced versus the voiceless sounds. If that's too difficult, again, back up and go to those just sounds in isolation. What is continuous voicing? Continuous voicing is when the vocal cords are on the entire time. So we are focusing on trying to get your patient to have their vocal cords come together and vibrate the entire time. So again, their vocal cords will come and they'll be closed when speaking. So first I'll have my patient sit up nice and straight, focus on taking a big breath in, and I'll provide them with a word list that has sounds in it where the voice is turned on. The list will look like this: dog, road, brain, gobble, lemon, ringing, goodbye, video, lovingly. You may have noticed that my hand was on my throat, and sometimes that's easier for patients to have that feedback and they can feel the vibration. If they're having difficulties with these word lists or this exercise, you may want to start out with just some humming exercises and have them focus on getting their voice and vocal cords to come together and vibrate. Feel the Again, focusing on having their vocal cords come together, and so they have that continuous vibration. Good luck teaching your patients how to complete continuous voicing voice therapy exercises. For everything else, including free PDFs, be sure to check out adultspeechtherapy.co.